Hello, my name is Kimberly Redding, and I'm doing an evaluation assessment module for my master's class. My student's name on this elementary evaluation is Patsy Good. She is an 11-year-old girl who's been diagnosed with autism spectrum disorder. She lives with her mother, father, and older sister. According to her mother, the pregnancy and delivery were normal. Her medical history is positive for seasonal allergies, an allergy to penicillin, and ear infections. Mother reports a sensitivity to gluten and has removed this from her diet. She has received speech therapy and occupational therapy through Arkansas Pediatric Therapy, as well as through school-based therapists. Because of disruptions to her daily schedule, she no longer receives these services at school. She attends Hackett Elementary and is currently placed in the self-contained classroom and does her classwork via stations and visual schedule systems. She struggles with meltdowns when she is frustrated. These meltdowns involve loud crying, screaming, hitting, pinching, scratching, and biting. Her last assessment was done when she was 6 years old. She will be given another assessment this year to measure any academic growth. Patsy was previously diagnosed with autism spectrum disorder through Schmedding Developmental Center. The Autism Diagnostic Scale Evaluation Scale, ADOS, was administered and determined that Patsy's performance is consistent with the presence of moderate autistic symptomology. She struggles with verbal communication, eye contact, and the use of nonverbal communication. She is able to respond positively to some structured interactions. She displays unusual sensory interests, hand movements, and stereotyped use of phrases. She continues to be socially withdrawn from social interactions at school and requires a lot of one-on-one help managing emotions. The psychoeducational evaluation was completed over 4 years ago when Patsy was in pre-K. It was very difficult to determine which skills were strong and which skills were weak. The RIAS, which is the Reynolds Intellectual Assessment Scale, indicates that Patsy has a composite IQ score that falls below the average range. Her score was 65, and the average range falls between 85 and 115. The Wechsler Individual Achievement Test shows her academic achievement in early reading skills, math problem solving, and alphabet writing fluency all fall below the average range. I was able to pull information from the Vineland Adaptive Scales form to get a clear picture of her abilities. In all 4 domains, Patsy is low, and her standard scores indicate that she struggles greatly with behavior. The curriculum-based assessment indicates that she is proficient in skills in all areas assessed. However, the depth and proficiency is limited. She lacks the skills for sequencing and retelling a story. She cannot identify 2 words that rhyme. She cannot match 3-letter sound matches or use symbols or drawings to express ideas. She does not understand concepts of more than 5 objects or know her parents' first and last names. This assessment is not helpful in creating a new informal assessment because it is not current and does not present an accurate picture of Patsy's abilities. According to the assessments presented in this evaluation, Patsy meets the eligibility requirements for special education services under the handicapping condition of autism. She would benefit from behavior modifications in the academic environment based on low scores from the adaptive behavior assessments. Once a new evaluation has been completed, they should begin working on the skills identified as emerging and not present. Hearing and vision screenings were passed on 9/6/16, indicating normal acuity in both areas. Patsy did use glasses for this assessment. An occupational therapy assessment was completed on 5/7/15. A standard score of 76 or below indicates a need for direct occupational therapy services. Patsy scored a 70 on the visual motor integration test and a 75 on the motor coordination test. The therapist was unable to perform the visual perception test. The short sensory profile was completed by her mother. These scores indicate that she has a limited or poor sensory processing in the areas of seeking sensation, auditory filtering, and visual auditory sensitivity.